What happens to our bodies when our hormones decline?
A lot of things happen to our body. You lose your energy, your drive, your libido.
So it might start out with symptoms like waking up in the middle of the night sweats, and it progresses to hot flashes, irritability, forgetfulness, that brain fog.
And also as the hormones drop farther, even your collagen, your skin, and your appearance is affected by it.
So a lot of women will go to their doctors and they'll give them antidepressants. Well, that'll make them gain weight. Then they go to take diet pills. And then, of course, as their hormones continue to decline, their cholesterol goes out of whack, so then they're taking cholesterol medications, blood pressure medications. And really the root cause is just because the hormones are dropping.
Traditional medicine just treats symptoms as you develop them. The idea between anti-aging medicine is you don't ever have to have those symptoms.
There's a lot of controversy around hormone replacement therapy. Is this safe?
The controversies and the issues that they had to do with synthetic hormones, not bioidentical hormones.
And that's coming from the women's health initiatives from the early 1990s. And they looked at Premarin and Prempro specifically. Now, Premarin is a conjugated estrogen that comes from pregnant horse urine. It's not the same estrogen that our body currently produces. So when you're exposed to those estrogens, they're not metabolized the right way, and it can damage surrounding DNA in the cells. And if it damages the DNA in the breast, it can predispose you to breast cancer. And if it does it in the ovaries, ovarian cancer. Endometrium, the endometrial cancer. So when you're looking at bioidentical hormones, this is the exact same cellular structure as what your body currently makes. So it doesn't have that breakdown, that metabolism that damages surrounding cells.
What are some of the benefits of bioidentical hormone replacement therapy other than just balancing your hormones?
It helps to protect the heart, it protects the arteries against atherosclerotic deposits, it protects the brain against Alzheimer's disease, and it also helps to protect the breast against breast cancer.
It has lots of positive things. It lowers cancer rates, it makes people sleep better, they have more energy, drive, libido, their muscles are strong, their bones are strong, their brains work well.
At what age can you start hormone replacement therapy?
The majority of the people, women by the time they're 30 to 40, start becoming candidates for this usually. They need estrogen usually, they need testosterone, they need progesterone. For men, it's primarily testosterone that they need to do. And by the time they're 30 years old, it starts dropping 1 to 3% a year.
So women not only get estrogen, they get testosterone too. Why is that?
Yeah, that's a good question that I get asked a lot. A lot of women worry testosterone is for men, estrogen is for women. Why do I need testosterone if I'm a girl? And the difference is we actually have both testosterone and estrogen. Both men and women have both. So it's not that men have testosterone and women don't. It's the amount that we have.
So what is pellet therapy?
When people first come here, the first thing I want to do is a lab, and that'll show me where your levels are at, what's going on inside. Based on the lab's height, weight, past medical history, that gives me a roundabout starting dose.
And we place these little pellets under the skin, the upper buttocks area. On day 3, your blood supply wraps around it and starts absorbing it.
The pellets themselves are just bioidentical hormones, and they're compounded, they're put together into a pellet.
And this is a way to keep your bones strong, to keep your mental functioning good, to make your muscles good, to get rid of belly fat, to reduce inflammation. And this is the types of things that people want to experience as they get older.